everyone, and thank you for joining us today for our Psychology and Clinical Mental Health Counseling information session. Without further ado, I will turn it over to Dr. Qualls, and he will begin his part of the presentation.
Well, good afternoon, good afternoon. And Ms. Campbell, I would say, if you wouldn't mind being so kind as to monitor the chat for me. I am just not so great at monitoring chat and speaking too. I'm that guy that really cannot chew gum and walk. And so if you can do that, I'd appreciate it. So it's good to be with you today. I'm actually in a classroom here up at our School of Health Sciences in Marion. I just finished teaching our PA students, some of whom are still in the room, behavioral medicine and psychiatry. And so we're in the second semester of that. Normally, I'm on the main campus where I teach more of the clinical courses, and so as we'll look at in a second, my training is in clinical psychology. But I'm so fortunate today to be joined by my colleague, Dr. Stephanie Hall, and Stephanie is new to Emory, but we are just excited to death that she is here because she is the director of our brand new Master's in Counseling program, a program that at the undergraduate level we have been just pining for years and years, because we're excited about the opportunity to actually offer graduate degrees in counseling so that students can be better prepared to actually help others in this area. So Stephanie, a big wave to the students, or hello to them. Thank you. And not too much longer, we'll certainly have her talk about the Master's of Counseling program that she's really done a great job with. We've gained approval on it, and we're just looking for people. And so we're looking for that. Frankly, we're looking for undergraduates who are very interested in coming to Emory and Henry to study psychology. But then we want you to really think about joining us up in Marion and being a part of our counseling program as well. So we're excited that you're here. So if it's not too revealing, I wouldn't mind kind of you introducing yourself and telling us a little bit about what you're interested in, where you are, and that would be a good kickoff. After that, I'll certainly start my slide presentation and talk a little bit more. But I see to the left on my screen, I see somebody by the name of Christopher. Christopher, you wouldn't mind introducing yourself? I would appreciate that. Maybe.
Can you hear me?
Yes. You're coming through perfectly clear.
Hi, my name is Christopher Kirksey. I live in Richmond, Virginia. I'm thinking about attending Emory and Henry.
Oh yeah, junior or senior, Christopher?
I'm a senior.
Excellent. Well, we're excited. Thank you for coming today.
Thank you.
And in the middle, I want to make sure I pronounce his name correctly. Is that Noor? Is that how you say that?
Yeah.
Very good. We're glad you're here. Where are you coming from today? Where's home? Where's home for you? Oh, you may not be hearing me very well. And to my right, I have Olivia. Olivia, it's good to have you today. Where are you coming from today?
Hi, my name's Olivia. I live in Penlayered, Virginia, it's like right outside of Harrisonburg, Virginia. Not a lot of people know where Penlayered is, but it's really just a bunch of neighborhoods. I'm a senior in high school, and I'm thinking about double majoring in history and psychology.
Oh, excellent. Well, that's great. I'm certainly glad that you're here today. So what I'm going to do now is I'm going to share my slides with you and kind of walk through the presentation. And as Rachel mentioned, certainly I'll allow questions at the end, but if you have questions as we walk through the presentation, you're certainly welcome to ask those, either just shouting them out or putting those in the chat, and Rachel will be kind enough to let me know their questions there, and either Stephanie or I would certainly be happy to answer those questions as it would be. Just let me get to make this a little bit bigger here. Okay, I hope you can see that. So once again, my name is Dr. Chris Qualls, and I'm a licensed clinical psychologist. Teach psychology at Emory Henry. I'm also a consulting psychologist for our local community service board, and that's the equivalent of kind of a mental health agency. I'm a child and adolescent psychologist is primarily what I do. And of course, we're joined with Dr. Hall, who's a licensed professional counselor. And I think Dr. Hall can certainly speak for herself, but I think probably a little bit more on the adult side of the spectrum than the child side of the spectrum, if I remember correctly. Is that right, Dr. Hall?
That is correct. Yeah, I do maintain a small private practice where I see the youngest clients I work with are some teenagers, but mostly adults, and primarily trauma and grief counseling is my specialization.
So between us, we've got them from cradle to grave, as we say, in terms of being able to talk about it. So here's a broad outline of what I would like to talk about this afternoon. Anytime you're thinking about going into a different field, one of the first questions you need to ask is there a need for me in that field? If even at the most callous of reasons, will I find a job? Will there be a job for me when I graduate? There's nothing wrong with asking that question. But probably a more substantial question is, does the field really need me? Is there a real call for that? And so I'm going to present to you what I believe is evidence for the need for mental health professionals, both at the national level, then more specifically at the regional level. And then after that, I'd like to talk a little bit about what I think are the personality qualifications. We talk a lot about academic qualifications, but I think Dr. Hall would agree with me that this is a field in which being the right type of person is maybe almost important as the right type of degree in order to be effective in working with people. And so we'll talk a little bit about what I think those qualities are. Now, I wouldn't be scared off if you don't feel like you have all those qualities yet. I would tell you, when I was 16 or 17 years of age, I had to measure myself against the qualities that I think are important to be a professional counselor. I would come up short, very short. And so these are things that you grow into over time, but it's important to know what they are so you can begin shooting for them. We'll talk about the different types of mental health professions. A little bit about Emory Henry's program, and then I'll let Dr. Hall certainly answer your questions and talk to you a little bit about our graduate program, our Master's of Counseling program. So that's kind of what I have today. So, and I've got pictures. Ooh, everybody likes pictures. I've got pictures of former students, and I want to talk to you about where they are, because I think it's important to be able to see the people who come through the program and know where they end up so that you can have an idea of where you can be too. And so that's what we'll be doing this afternoon. All right. So I don't want this to be too morose. I don't want this to be too heavy, I guess is the word that I would use. But I can't think of any other greater way to demonstrate the need for mental health counseling today than to look at this chart. And it's color coded, and I hope you can see it well on your computer. But what I want you to look at for just a second is the green. I want you to find the color green. And what you see in the green, unfortunately, is you see the deaths that are attributable to people taking their own lives by suicide. And you'll notice when you look at the green that the second leading cause of death for individuals between the ages of 10 and 34, that's a lot of years, right? 10 and 34, that the second leading cause of death is suicide, people taking their own life. Just in this last week in our newspaper, there was a young man who graduated with my son from high school who took his life, the same age as my son, in his 20s. And so that's an unfortunate reality. In fact, we know that with COVID and all the stressors associated with that, that unfortunately there are more people that have thoughts about doing that and people who are actually doing that than really probably in our nation's history. And there's lots of things that make me very, very, very sad about people who take their life. But probably one of the things that make me the most sad is that it's a preventable death. When we look at some of the other causes of death, such as cancer and heart disease, sometimes they're not as preventable, but suicide is always preventable. And one of the things that mental health professionals do is they save lives. Now, that's not something you think about. You think about trauma surgeons, you think about ER docs, you think about other people saving lives. But I will say to you that effective mental health professionals save lots and lots of lives. And so if you want to go into a profession in which you can go home every day and you can say, I probably saved somebody's life today, this is it. This is one of the things that we do. And as you can see, that green, unfortunately, kind of goes all across that chart. So it's not just young people, unfortunately, that are taking their lives. It's older people as well. And so when you want to look nationally at the need for mental health counseling, I don't think you have to look a whole lot further than this chart to say we're not doing enough to help We don't have enough hospitals that care for people. We don't have enough counselors that care for people. And so that's one of the things that I would show you. Okay. Now, what about by the region? Well, here's a map. And now the color that we're looking for is blue. So I want you to look for the blue, the dark blue. Now, look east of the Mississippi, so the eastern part of there. And then when you look at the eastern part of there, I wish I had a little pointer. I'd point to Emory, Virginia. But if you can see kind of where the state of Tennessee and the state of Virginia go together, you're going to see a lot of blue. It's like a little spine that runs up through the Appalachian Mountains. I don't know if you can see that or not, but there's blue in there. Now, I wish this were a map about something other than what it's really about. And you can see what it's about at the top of the screen. And what it's really about is the suicide rate. And so where we live right now, where Rachel and Dr. Hall and I stand right now, has one of the highest suicide rates of any place on the east of the Mississippi. And that's because of a lot of factors. It's because of increased rates of poverty. It's because of increased rates of substance usage. It's a lot of factors. But one of the factors that it's the result of is lack of access to good mental health care. There are just not enough people out there that are saving lives through mental health services. And I don't know where Dr. Hall comes from, New Jersey, but I know here she's probably experienced the same thing. I hear patients that have to wait 2-3 months sometimes to really get in for good mental health care. I know even among my own caseload, sometimes it's 2 or 3 months before I can actually assess somebody. And so there's just not enough. I'm a part of a community service board that includes 5 different counties, and I am the only psychologist in that 5-county region. And so that's part of the blue that we see there. So you want to say, and you can actually, if you look over there in Richmond, wherever you're there, you can see a little blue over there in Richmond too. So we live in an area that we live not only in a nation that is in desperate need of mental health professionals, we live in an area that's in desperate need of mental health professionals. Okay. So what is it that makes an effective mental health professional? Well, the first, this seems kind of, why would you even put that on a slide, Dr. Cross? But I think it's important to put it there. The first thing is you have to be interested in helping people. You have to really want to help people. Now, you would think that everybody who goes into mental health or everybody's interested is really interested in helping people. But what I would say to you is this. I certainly spent 12 years of, elementary school, middle school, and high school. That was certainly something I did. And I would like to tell you that every single teacher that I had was very interested in me learning. I would like to tell you that, but I can't. Now, I know that at some point they probably were interested in that, but they got burnt out along the way or something happened to them. But what I will say to this is I would like to tell you that every professional counselor was interested in really helping people, but unfortunately, not enough are. So we need people to come into the profession who first and really importantly are interested in making a difference in people's lives. That's important. Socially skilled. So now, socially skilled doesn't mean that you always know the right thing to say, and because sometimes I don't know the right thing to say, but it means that you're really learning how to interact with people in a way that helps them. You're not focused on you. You're focused on knowing how to help them. And that's what it means to be socially skilled, is learning the skills that allow you to effectively work with individuals. You see, as counselors, as people that help people, what do we have to offer to them? Well, we have ourselves to offer to them. And that's enough. That's enough to help people, is being able to offer yourself to another person. But you have to do it in a way that's authentic, that's meaningful. And that involves, having the right skills, social skills, to be able to do that. Friendly. I mean, who likes to talk to a grouch? I mean, come on, really. I mean, when I talk to somebody, I want to talk to somebody that's, okay, nice, and actually wants to talk to me. And so being friendly, being warm, being open is important. Warm. Now, this is the one that has always kind of mystified me. But in every survey that we see about effective counselors, when people rate who's effective or who's not effective, it's warm. They say warm. Now, I don't know if that means whether their hands are warm or I don't know exactly what that means, but I think you do. People who really seem to have that, caring attitude that allows them to exude a sense of warmth, a sense of caring, is probably what's being captured in this word warm. Psychologically healthy. So I'm asked this question a lot. I've had psychological problems. I've gone to counseling myself. Sometimes I've struggled with depression or anxiety. Does that exclude me from being an effective mental health counselor? Well, that's a great question. I know Dr. Hall has certainly heard that question many times. And I certainly would be appreciative of her answer, but my answer is this: no, it doesn't. What it does do, though, is it says that you have to be in a position where you've worked through a lot of those things so that you are emotionally and psychologically available to help other people. But boy, oh boy, when the day comes when you have to be psychologically perfect in order to help people, well, that kind of rules out pretty much all of us. Dr. Hall, what would you say to that?
Yeah, I would agree 100%. In fact, I would question the motives of a counselor who had never gone to counseling themselves. I think, it's like, would you want to see an MD if they said, oh, I'm pretty healthy, I've never been to see a doctor before? No. But yeah, I agree. It's something that you need to, that all of us have mental health. All of us need to constantly monitor our mental health and seek treatment when we're struggling. So, and I think it, in many cases, can increase empathy.
Oh, I absolutely would agree. And I would even add to that to say that as a person who's been to counseling, different types of counseling, some of the most important things that I learned was from being on the other side of the couch. From actually receiving help, and it is an important thing to do. So psychological health doesn't mean that you don't have problems. What it means is that you're actively working to make sure that your problems are not getting in the way of your ability to help other people. Complementary communication style. That's complimentary, not, hey, you look nice today. That's complimentary in the sense of you kind of know when to talk to not. You know when to listen, you know when to talk. One of the things that I tell students who I train is that listening is a clinical intervention. Sometimes we don't think about listening as doing anything, but I would say listening is sometimes the most important thing that you can do. Now, if you just listen all the time, obviously that's not going to be enough. You do have to say the right things at the right times, but it's important to listen. Complementary communication style really means you know when to talk and you know when to listen. But one of the things that we know from our research is that psychologists and counselors who talk all the time really don't do very well with their clients. That it's important for the clients to really be doing the majority of the talking, and it's important for us to do the majority of the listening and to make comments in the right proportion. So complementary communication style, and that's one of the things I've really worked on over the years, is being able to just kind of step back and hear what people have to say. Perceived expertness. What does that mean? Well, you do need to know something. I think it's not like degrees aren't important. They are important. The reason why we were so interested in starting a master's of counseling program is because that degree and then the license that comes out of that, the licensed professional counselor, says to the world, says to the community, that I care enough about people that I've gone through specialized training in order to be able to help folks. And so, and it's important for counselors to have self-confidence, not arrogance, but to have confidence that they really do know some things that will be able to be beneficial to their clients. And that's what I mean by expertness there. I don't mean that you know everything all the time, because none of us do, but it means that you know enough to be able to be effective in working with people. And then you have to really believe that counseling works. That sounds almost as kind of, cliche as interested in helping, but there are actually out there are folks who actually question the value of whether counseling works. And I certainly have met people that say, oh, that's a bunch of hogwash and nobody really benefits from that. Well, certainly effective counselors don't think that. They have seen time and time again the value of what psychotherapy, what counseling can do. And so when they go into sessions with people, they know they go in understanding that they really have something to offer and that counseling really has something to offer. And so that's a trait that I think is important. And finally, I would mention this. Now, this is one that can be a little tricky, and so I'll take a minute with it. A self-disclosure. Self-disclosure doesn't mean that you tell somebody all about your life. In fact, clients are not really interested in, kind of my hobbies. They're not really interested in that. They're not interested in the fact that I had a fight with my wife this morning. No, they really don't know that. But what self-disclosure means is that you're open and transparent enough to be a real human being in the room. You're not a robot. You're a person that has feelings, has emotions, and when things hurt, you hurt. And when things are good, you're happy. And so you're willing to share in appropriate amounts about the things that are going on so that people can benefit from those. And that's kind of what I would mean. Now, Dr. Hall may add, if she had this list, if she were doing this, she might add a few more to that. And I'm certainly open to that. But those are some of the qualities that I think are important in terms of what make good mental health counselors. Stephanie, is there something you would add to that or comment on?
Yeah, I guess the one thing I think that sort of runs through all of these is that you need to have an openness to feedback. When we talk about being socially skilled and having a complementary communication style, we all know how to speak, but that doesn't mean we know how to do it therapeutically. And so sometimes I've run into students who come into training for mental health counseling, and they've always been the best listener in their friend group. And they're shocked that they need to get feedback about how to adjust their communication, right? But none of us are born being counselors. So I would just think being open to feedback and understanding that you'll be providing feedback to your clients when you work with them. And so you can only do it as much as you're comfortable hearing it, that you could slightly improve. The first time a counseling student records themselves with a client,
oh, me.
They need to process it for 3 days. They count the number of times they say Yeah, we all have those things. But I would say openness to feedback. And the only other thing I would add is the belief in therapy and that it works. I think a big role that we have for people many times is instilling hope.
Mm-hmm, mm-hmm.
Right. So Yalom talks about the installation of hope, and how can you instill hope in someone if you don't believe in the efficacy of therapy? Right. So sometimes I think people need you to say to them, I've seen this work for people who are in a lot of pain, and maybe even give an example, so yeah, have something to back it up.
Yeah, absolutely. Absolutely. When I teach listening and people do record themselves, or when I comment on them, they are surprised at how much, I'll say it in a more positive way, they're surprised at how much there is to learn. So
right.
because there's a lot to learn, and learning is something that continues even when you get all this gray hair too. So it just never stops. Absolutely. So the good news about the mental health profession, and frankly, the good news about Emory Henry, is that there are lots of ways that you can go into training to learn how to be an effective mental health counselor. I'm a clinical psychologist. Dr. Hall's a licensed professional counselor. I'm standing in a room where we're training physician assistants. There are lots of ways that you can learn how to help people. And that's one of the beauties of training at Emory Henry, is that you can, we can send you on those pathways. And so I'm going to show you, I'm not going to spend a lot of time on this because I'm going to show you lots of pictures at the end of people who are in these various professions. And so all I'll say is that there are lots of ways that you can fit. You don't have to be like me. You don't have to be like Dr. Hall. You can be other ways and still be very effective with people. And part of our job, I would say, Dr. Hall, part of our job is really because we've seen lots of folks go different ways, right? And part of our job is kind of helping people. I think you would be good doing this, or I think you would be good doing that, and guiding them to that. Even if it's not really our program or what we do, we see in them things that would allow them to kind of go this way and be effective. So I could add I'm sure Dr. Hall could add other professions to this list. We could spend we could add occupational therapy, couldn't we? We could add other ways to this list, but this is kind of a broad list that it's kind of a thumbnail sketch of the different professions that are there. And we've all had students who've gone, I'm sure, to all of these different professions. So talk a little bit about our program at Emory Henry. Well, we have two basic bachelor's degrees in psychology, both of which prepare you very well for any of those programs. The Bachelor of Arts degree is probably one that most of our students take. Probably about 85 to 90% of our students who major in psychology major in the Bachelor of Arts degree. It's one that certainly prepares people to go and become counselors, get masters in counseling degree, but also psychologists and others as well. The Bachelor of Science degree is a little bit more science heavy. No question about that. A little bit math heavy. And it really prepares people to go into more of the biological aspects of the field. So become physicians, physician assistants, become a clinical neuroscientist, and so more of that. So, and it's a great program as well. And then I would say this: you don't have to have a psychology major in order to enter into lots of programs, including our own, if I'm not mistaken, Dr. Hall, that you can have a minor in psychology, and as long as you've taken the right courses, you are prepared for the next level. Is that right? Is that right, Dr. Hall?
That is correct. But I always encourage people when I talk to them at the undergraduate level that if they know they want to go into mental health counseling, the absolute best fit is a degree in psychology. So while it is possible to come in through other majors, I mean, probably for what are obvious reasons, the best fit is a psychology major.
Yeah, and it's the most fun. Okay, come on, it's the most. It's not.
Well, that too.
Yeah, it's
I
not.
mean,
It's
wouldn't want
not.
to be with Dr. Qualls for
Oh man, absolutely. It's not easy. And Ms. Campbell could talk about that. It's not easy, but in terms of, is it relevant? Will you do something with it? And the answer is absolutely, absolutely yes. Okay, so these are the major degrees that we have. Now, one of the things that we really pride ourselves on, we really do pride ourselves on, is, when you go to a smaller school like Emory Henry, like when I have classes that, classes that have 10, 15 students in them. My largest class has like 30 students. You get a lot of one-on-one time with professors, and that one-on-one time allows you to do a lot of research, because research is important. Research is what separates us from hocus pocus sorts of things that really don't matter. And I'm just putting up just a couple of years. You can see that this doesn't go back very far, but these are just 5 papers, including one publication that different students that we have worked on. And these are just my students. I have 2 colleagues in the department, Dr. Guy, Dr. Baranowski, who have students that could put these up as well. But you can see some of these. So, and I'm going to show you pictures of some of these in just a little bit. But Emily Young and I have a paper that will be presented called Differences in Aggression Among Children with ADHD and Depressive Symptoms. And so we did a study in which we looked at how mood disorders, depression, actually are associated with children who have ADHD, and it causes them to be more aggressive than just children that have ADHD alone. But you can see some of the other papers that we've essentially presented and published in the last few years. I'm biased here. I just don't think you're going to get those same opportunities at a lot of schools. The ability to work one-on-one with professors, to do the research, to go to these conferences, and here's the deal: we help pay for you to go to these conferences. Okay, places like New Orleans and places like Atlanta and various places, we help with that. And so I wanted to present some of this, and I could have presented, believe me, a lot more. But this is one of the advantages of being in a smaller school where you work one-on-one with faculty members. Okay. All right. So I'm going to let Dr. Hall talk a little bit about our program that I'm so excited about, our Masters of Science in Clinical Mental Health Counseling, and then I'm going to come back with pictures and show you some of our successful alums. Stephanie.
Thank you. Well, I won't go into great detail because this is a little ways down the road. But we want you to know that if you want a career in mental health, that there is the option of staying at Emory and Henry to get the master's degree in clinical mental health counseling. The main questions people ask first are, how long does it take and what can I do with it? So those are the things I'll focus on. 2 years to finish the master's degree. So it's a cohort model program, meaning you start in the fall of year 1, you finish in the summer of year 2. And what does it give you? It meets the requirements to apply for licensure as a professional counselor. So in any mental health profession, there are educational requirements and then there are experience requirements post-masters, right? So this curriculum is designed to prepare you to become, in the state of Virginia, what is called a counseling resident. And then you collect hours to become independently licensed. The entire program takes place on our Marion campus. So the psychology undergraduate program takes place in Emory. But certainly there will be opportunities should you decide to come to Emory and Henry and major in psychology for you to visit the Marion campus so you can see how great both of those campuses are. But we have an experiential training model for the program. So there's an entire counseling lab suite where there are 6 individual rooms and 2 group rooms where we will do experiential training in there. In year 2, there's direct service clinical work that you'll be doing work in the community supervised by faculty. And that can be in any area from addiction counseling to work with couples and families, children and adolescents. So it's designed to be a really small program, cohorts of 18 students, so that you have that individual attention from faculty that can help you decide sort of within mental health counseling, what are you interested in specializing in? And I always say to people, even when they're starting the program, it's okay if you finish and you still don't know, because what I thought I would specialize in when I graduated and what I ended up specializing in were 2 totally different things. So it's fine if you say, you know, I just want to take electives in areas that interest me, but I'm not sure yet. So we have students all across the board, some that come in saying, I've known since I was 16, I want to work with people with eating disorders. Well, that's fine too, right? But most students, I would say, don't know that specifically. So if you are interested in the program, you could look at our website just as a preview. The whole 60 credits is laid out there and in sequence, so you could kind of see what the training looks like. But we do have an agreement only for psychology majors at Emory and Henry that you can apply early and gain early acceptance to the program. So you could do that as a junior if you knew that this was the path you wanted to take. So that's something too that you could inquire about if you're interested. And we'll have time at the end for questions as well. But I would assume most of your questions might go to Dr. Qualls, but I'm here just in case.
Thank you, Dr. Hall. I can't emphasize enough how we're really excited about this addition to have people come and to know by your junior year kind of what you're going to be doing for the next steps. I think you'll find that that's a real blessing. That's something that really is not found in many places, and so that's a real plus of our program. Oh, I promise pictures. Okay, so I love pictures. So on the left is one of my favorite students, Dr. Emily Young. Well, not quite doctor yet, but Emily's a 4th year medical student at VCOM, which is the College of Osteopathy in Blacksburg. And she's going to be a physician at, a couple more months. And Emily you saw one of the papers that she worked on, but one of the things I'd say about Emily is she was the winner of a National Health Service Scholarship. Now, let me tell you about a National Health Service Scholarship. That allowed her, it paid for all 4 years of her medical school, and including her health insurance and a stipend. So she will graduate from medical school with no debt whatsoever. And so we worked with her to help her gain that. And so she's very excited about that. She's at the VIA School of Osteopathy, but she's a psychology major. Okay, she's by her, I believe, her partner, or maybe her partner to be for a long time, as I understand it. And so she's there. On the right is indeed Dr. Callie Scott, and Callie's a resident. She graduated from Virginia Commonwealth University in their School of Medicine, and she's a 3rd-year resident in dermatology. And she and I, you can see the paper that she presented there at one of our conferences, looking at disease testing and genetics, and trying to, asking who wants to learn about genetic diseases that they might have, even if they didn't know they have them. So she's a physician. Both of these individuals graduate with Bachelor's of Science degrees in psychology. We have on the left Beth Walton, and Beth is a psychologist with in private practice in Knoxville, and was a student in Emory, and she graduated from actually the same school doctoral program as the individual on the right, David Bull. Dr. Bull is a clinical psychologist with Cherokee Health Systems in Knoxville as well. Beth is a child psychologist, and David actually, very interesting, David does what we call behavioral health. And behavioral health is an area within psychology, relatively new, probably certainly new for me, maybe not for Dr. Hall, but certainly new for me, in which you actually use a lot of psychological principles to actually help people be healthier, physically healthier, working with people that have diabetes and heart disease. And he uses psychological principles to help that. And Beth, of course, who grew up 10 miles from where I'm standing right now, works with children who have mental health needs. Do you have to go into the field per se? No, on the left is the graduate of the program that I'm standing in right now, Ryan Short. He's a physician assistant. And Ryan graduated from here just last year. I believe Ryan is up in Korea now, up in Roanoke, doing work up there. Psychology student, played football for us, and then did day treatment counseling, worked in one of the local high schools working with kids, and decided I want to become a physician assistant, and graduated from here. And on the right, that's Hannah Doss. And Hannah is working actually about 3 miles from where I'm standing right now. She has a doctor of physical therapy and came through our program as a psychology major and decided that she wanted to be a physical therapist and went on to get her degree in physical therapy. So do you have to have a graduate degree? Do you have to go on to work in psychology? And the answer is absolutely no. So on the left is one of my absolute favorite students of all time, and he's standing at Kilimanjaro. So as an undergraduate, he took a semester off and he traveled overseas to Africa to do some exploring of the continent there, Tanzania. And so he's standing at Mount Kilimanjaro. And Logan Clater, Logan now works for a group that actually uses wilderness activities to help people better understand their world. So I think he's in Montana. And to the right, and this fits very well, you can see the photo, it is one of our students, Kevin Watts, and Kevin works for guess what? The FBI. And so he works on the FBI, and so he's working from a different direction of dealing with people and actually trying to, as Kevin would say, he's trying to catch the bad guys out there. Came through this program as a psychology major. So all of these, you see just how many different professions are that, both graduate, undergraduate, all of those are individuals that have come through the program in the last couple of years. I'm not going back to 1967 or anything. We're looking at the last couple of years. And you can see yourself in one of those roles as well. Okay, so those are my last picture. So one of the beauties about Emory Henry is that we do service. We're very interested in helping others, not waiting until you graduate to help others, but actually helping others now. And so we go to remote area medical clinics and we provide volunteer service. And I could go through and I could name all of these individuals. In there, I see pharmacists, I see psychologists, I see physician assistants, I see physical therapists, I see physicians, all of whom were undergraduates here and helped in providing that service. And so I think that's the last slide I have, that I wanted to show those pictures. So Rachel, I'm very happy to take any questions. I know Dr. Hall is very happy to take any questions about either of our programs if people have those. If they don't have those, we're just happy to spend time with you today.
Olivia?
Any questions out there? Olivia, any questions for us that you have?
I have one question.
Certainly.
So when you go, I forget what the campus is called, but when you go to the master's program, do you live there or do you live off campus?
Well, let Dr. Hall answer that.
You could do either. So a lot of students do tend to live in apartments around the campus, but there aren't dorms in Marion, so you could certainly commute. In fact, if I were guessing, I would bet that most of our students will be commuting from other areas.
Yeah, so either it's there, and housing's really not too much of a problem to have, and they're both good communities. That's a great question, Olivia. Other questions, either you or Christopher have any other questions for us? Well, Rachel, thank you so much for facilitating this. And I know I've enjoyed talking with these individuals. And one of the offers that I always make to students too is that if you are interested in showing up in one of my classes this spring, all you have to do is let Rachel know that, and I'll work out a time where I'll send you a Zoom invitation so you can show up in my introductory class or my abnormal psychology class, and I'd love to have you as a guest student for a day. So if that's something that interests you, just tell Ms. Campbell or your admissions counselor that's something you're interested in, and we'll make sure that we accommodate that.
Absolutely.
All right. Thank you, Rachel. Thank you for hosting.
Thank you, Dr. Qualls and Dr. Hall. If there are no
Thank
other
you.
questions, you are more than welcome to head out for the evening. If you do have any follow-up questions that you think of down the road, you are more than welcome to email them to me and I can always pass them on. Dr. Hall has just shared her email in the chat, so you're more than welcome to reach out to her as well. But any questions moving forward, feel free to reach out to us. We are always happy to help, and you are more than welcome to head out and enjoy the rest of your evenings.